Hi, I'm Dr. Ian Johnston, continuing our series on playing in the sandbox with Cerner. One area of potential confusion is the difference between planned and proposed orders. Although they sound similar, they are very different, and they're used in different situations. A planned order is commonly used when we know what is going to happen, but it just isn't time yet. An example might be someone ordering a surgery, or someone who is ordering inpatient orders from their office. They can fill out the appropriate orders, put it into a planned state, sign the orders, and then they will be initiated at a later time, perhaps when the patient gets to the OR or when the patient gets to the hospital. When an order is placed in a planned state and signed, it doesn't need to be signed again. It can be initiated by nursing staff in the hospital when the time is appropriate. A proposed order, on the other hand, is quite different. A proposed order cannot be initiated by a nurse and needs further approval by a physician before it can go ahead. There are a few situations where this would come up. Any order entered by a medical student, for example, is entered in the proposed state and must be co-signed by a physician before they become active. Another time where you could use a proposed order is when you're doing a consultation for a most responsible physician. Perhaps a surgeon would ask me what I thought we should do with regards to analgesia. I would make my suggestions and place them in a proposed state. The surgeon could then look at them and say, well, that's asinine, I will not sign those, and they can be deleted. Or he could look at them and say, yes, that's reasonable, and he will sign them and they will go into action. So let's spend a few minutes looking at how we place these orders. So here we are back in a patient's chart. Perhaps I have just seen this patient in my office and have determined that they need to be admitted to the hospital. I have called admitting, and they have made an encounter for me. The patient, however, hasn't left my office yet. I could go ahead and initiate a pediatric general admission order set, but place it in a planned state. So by way of review, we will search for a pediatric set. Order sets generally appear at the end, so we'll go to last, and I see here our ped admission to pediatrics general. It goes into my to-do box up here in the corner. I click on this and I want to modify details. We can see the order set as before. I can click off the orders that I feel are appropriate, and then instead of initiating now, I'm going to press a plan for later. If I press initiate now, the lab will come up and want to do blood work, and they'll be upset because my patient is still in my office. So I will plan this for later. Now I will also sign it, which means I've given my okay to these orders, but when the patient arrives at the hospital, the nurse doesn't have to call me. They can simply initiate the orders, get on with things without any further ado. It's very similar to a phased order set where the entire order set is entered in a planned pending state, and each phase is activated as the patient moves from the preoperative setting to the OR to PACU and so on. Proposing orders is a different process. You can propose any order. So let's pretend I am proposing electrolytes. After correcting my spelling, here we are. I will click on this. It will go in my to-do box, and again I will click Modify Details. Now this isn't entirely intuitive and will probably lead to some mistakes. This little box here is just begging to be clicked. Perhaps I think I have to click it in order to make this order live, but if you hover over it, you'll see that it's click to make proposal. So if I click this and then sign, this does not become an active order. This becomes a proposed order that must be co-signed by someone else in order to make it active. As I said before, anything filled out by a medical student, for example, automatically goes into a proposed state. So in summary, a planned order is fully signed off but has yet to be activated. A proposed order has not been fully signed off and needs further ratification by a physician or other qualified provider to go into action.